Pelvic organ prolapse is when your pelvic organs have dropped out of their normal position. It might include the bladder, the rectum, or the uterus. There are many different reasons why that might occur, but one of the basic concepts is that your pelvic floor muscles act like a hammock and they hold these organs in place. You also have tissues called fascia. The strong ligaments and fascia help hold those organs in place. Unfortunately, as you get older or as a result of trauma caused by childbirth, oftentimes that supportive mechanism has failed and you will have a prolapse develop. Rarely does it involve just one of those organs, or typically it involves more than one, and that's why it's referred to as pelvic floor prolapse, because many things are falling down. There are many risk factors that can further complicate the likelihood of you developing pelvic organ prolapse. One of the most common would be chronic constipation. Another is a chronic cough, heavy lifting or straining, or a family history of pelvic organ prolapse. Some of these you can modify, such as the prevention of constipation, but others, such as your genetics, you simply can't modify. When pelvic organ prolapse occurs, usually the symptom that is most common is the awareness of a bulge. Something is protruding at or past the opening of the vagina. Many women will have a mild degree of prolapse where possibly their bladder is only partway dropped into the vaginal canal, but typically that won't cause a lot of symptoms. When the prolapse reaches the vaginal opening, not only are the symptoms more prevalent, but also it's time to consider either surgical or non-surgical therapies. You can no longer ignore that minor pelvic relaxation. In addition to the feeling of bulge, a lot of people will have a pressure, a heaviness. They'll have discomfort, sometimes with intercourse, occasionally low back discomfort as well. Oftentimes, if it involves a rectocele, and that's a pocket in the rectal area, people will describe the stool getting stuck, and you'll have difficulty emptying your rectum when you attempt to pass stool. Mild pelvic relaxation, meaning that, for example, the bladder is dropped halfway into the vaginal vault, is present in at least 50% of women who have had children. Again, usually at that point it is relatively asymptomatic, but approximately 30% of women will develop prolapse to the opening of the vagina when it becomes more symptomatic. Studies have shown that approximately 18% of all women will have surgery for pelvic organ prolapse before the age of 80. So it is a relatively common problem. The key is to try to prevent that from happening. One way to prevent it is to get rid of those modifiable risk factors. For example, don't allow yourself to be chronically constipated. Try not to do a lot of heavy lifting and straining beyond what you consider reasonable. So if your prolapse does become more symptomatic, certainly a non-surgical approach is a good place to start. Oftentimes we'll have patients who are postmenopausal use a small amount of estrogen cream, and we carefully review the use of pelvic floor muscle exercises, also called Kegel exercises, to improve that hammock of support and to make your tissues stronger. Oftentimes that becomes quite effective with success rates that run about 30% for mild pelvic organ prolapse. One non-surgical option is the use of a pessary. A pessary is a latex rubber device that comes in different sizes and shapes that we fit you for like a pair of shoes. We teach you how to insert this into the vagina to hold the pelvic organs into a natural position. Ideally, you put this in your vagina each morning. You take it out at night before you go to bed. While certainly pessaries are a good approach to avoid surgery, it, in my opinion, is best used as a temporary approach. Another and very exciting approach to mild pelvic organ prolapse is laser vaginal tightening. The FemiLift procedure, which we've talked about previously and is located on this website, is a simple office-based approach where with a CO2 laser, the vaginal walls are tightened, and that tends to help very nicely a small cystocele or rectocele, because the vaginal tightening procedure provides additional support for those organs. When patients fail non-surgical approaches, oftentimes surgery is required for the management of pelvic organ prolapse. Certainly when that prolapse is severe, by that I mean it protrudes far past the vaginal opening, surgery is often the only option. In my opinion, the use of vaginal surgery for vaginal reconstruction is certainly the best approach. We can certainly perform a large incision, we can do robotic surgery, we can use mesh, but in my opinion, the best way to take care of this is a vaginal surgery, because that provides a faster recovery, less pain, and typically I'll have success rates in the 85 to 90% range. Those surgeries usually can be done under a simple epidural or spinal block, so we don't even have to put you to sleep. It requires an overnight stay in the hospital, and generally you'll be back to work in about 3 to 4 weeks. In patients who are at high risk for recurrent prolapse, for example, they have failed a previous surgery, I commonly will use an approach that involves augmentation. Augmentation of your own tissues can be done with synthetic materials, and it can also be done with biologic materials. The biologic material that is most exciting and is truly an innovation is the use of a product that stimulates your own stem cells to produce a stronger repair. That product is something that myself and a handful of other surgeons are using now to improve your outcome for pelvic organ prolapse surgery. I always emphasize to my patients that the success rate of your surgery depends not only on the experience and skill of the surgeon performing the surgery, but also on how you protect your surgery after you recover. There are many things you can do to make sure that prolapse never comes back, and that includes the prevention of constipation, making sure those pelvic floor muscles are strong and working properly. As a team, we get this prolapse repaired, and hopefully it will never come back.